I'm Dr. Kafrouni. I'm a physician in the St. Vincent, and I specialize in critical care, sleep medicine, and pulmonary medicine. It was mostly the science to start with, and being curious about what's in the human body and all that. And then as I got closer to making the decision on where to go for college and stuff like that, then at that point I was more drawn to the humanitarian part and helping people and figuring out how to fix somebody. And it started with science, but it kind of progressed to trying to do the right thing and to help people. Critical care is basically where I really found myself. I basically, during my rotations and as a resident, it just fit. It just felt right to help the sickest of the sick and to be able to make a difference for those people. I thought that's making a difference. I mean, I love what I do in every way. Being in the ICU, it's a lot of stuff coming at you, and like I said, I mean, when you're able to put things together and make a difference in somebody's life, it's huge. And I can think of a couple people who were as sick as they were, and they were pretty close to death, and then you see them a few months later coming to the ICU to say hello and to thank you. It just, I mean, there's not a feeling in the world like that. I treat people with sleep problems. It's not high intensity. It's a little bit lower intensity than ICU. But the other part about sleep that's really interesting is the patient satisfaction. When you make a difference with people's sleep, that's a big thing for a lot of people. I think the most important thing for patients is really that you listen to them and realize what their problem is and what they're asking you. And just taking the time to let them tell you what they're here for, rather than preempt things and start like guessing and interrupting and getting like one part of the story. I think letting them finish what they started to tell you and just listen and be attentive, I think is the best way, at least in my practice, that I found to build trust with the patient.